Please forgive the environment. I am sitting in the back of my car at a swim meet where Alex, one of the twins, has made finals for the 200 backstroke. So I didn't want to sit in the building for another 2 hours when I could be outside. But this long-term statin use can also cause incontinence. It doesn't have to be long-term use. In 2007, I had a client come to me who had started having generalized weakness, loss of use of his fingers, but he had some other symptoms that he wasn't really talking about, and one of them was incontinence. He was another one of those that with the stuff that was going on with his hands, and he got diagnosed with elbow tendonitis, and then he got diagnosed with trigger finger, and then he got diagnosed with this and that and shoulder stuff, and he failed physical therapy for 2.5 years, and someone finally sent him to me because they were like, maybe the dry needling would help him. I did an evaluation and thought, something's off here, but we're gonna try 3 visits, see how he does. And in that 3 visits, I was able to get a private room as opposed to just like a general table out in the middle of the clinic like a lot of the tables were. And I got him to kind of open up to me a bit. And one of his complaints was that he had incontinence. One of the things that I noticed about him, though, too, is that his skin had taken on kind of like a waxy appearance. So, his failure of physical therapy for 2 years and no one being able to figure out what was going on with him, we did 3 visits. His pain changed mildly. Super mildly. Like, not enough for me to say this is clinically significant and it's worth looking at. So I told him, I want the history of this from when it started, from the very first time you requested to go to physical therapy, or were told to go to physical therapy. And I want all of the lists of any medications you took, any hospitalizations, surgeries, what have you, so that I can compare them side by side. This man had been on a statin drug for 3 months when his symptoms started. And the first symptom was nighttime bedwetting. He was in his 40s, so it's definitely not normal. Due to sometimes genetic factors. So when different people are looking at how medications affect them, some people build up toxicities really fast, and some people build them up slower. So long term, for some people, statin drugs will cause rheumatoid arthritis, but for some people it happens in less than a year. Long term, some people will develop elbow tendonitis, but in some people it happens in less than 6 weeks. Long term, some people will develop incontinence, but for some people it happens in less than 3 months. The pharmacogenetics piece is a piece that we're still missing in all realms of medicine. And even sometimes the pharmacogenetics don't match what is happening because of the other environmental factors inside the person. I had another case where a pilot had started taking a statin drug, 5 milligrams 3 times a week. That was it. That was all it took. And he developed tendonitis so bad that he got put on leave from work, from his pilot job. He had seen a couple of physical therapists at a different clinic. His orthopedic surgeon sent him to my clinic. He saw someone else in my clinic twice. They asked, can you just take a look at him because I feel like I'm missing something? And I was like, yeah, sure, no problem. So again, evaluate him, go back through the whole thing, ask him the full history again, and was like, I see there's no meds listed, there's no medications you take, and he's like, nope. And I was like, all right, well, let's get you on the table and evaluate your physical body now that we've done the full health history. And he takes a pill bottle out of his pocket. And I said, I thought you said you didn't take meds. And he's like, oh, well, I mean, I don't really. It's like 5 milligrams 3 times a week. And I said, when did you start taking that? And he's like, 6 weeks ago. And I said, when did this elbow pain start? And he's like, 5 weeks ago. And I said, stop taking it. And he's like, what do you mean stop taking it? My doctor said. And I said, if he gave you 5 milligrams 3 times a week, he doesn't really think you need it. He's just doing it to cover his butt. Stop taking it. 10 days later, pain gone. Returned to work. hasn't had an issue since. And I actually know this because it turns out that he lives down the street from me. For some people, the side effects can happen so fast and so severe that a lot of people don't even attribute it to the drug because they think that shouldn't be happening yet. But again, that's where we have to take every single piece of the story into account and actually hear and listen to the person sitting across from us, as opposed to saying, well, clinically, that's not what should be presenting.